So for patients who have keratoconus, the disease is a progressive disease by and large, especially if it comes on early in life. And in the past, we had nothing we could do to slow down or stop this disease. We had to wear glasses and keep changing the prescription, or then go to contact lenses. And some of those patients would then keep getting worse and eventually end up needing a cornea transplant. And that's really all we had to offer for patients for so many years. In Europe, actually about 25 years ago, doctors figured out a way to stop keratoconus in its tracks. And it's a very simple treatment. It's not even a surgery. It's a combination of a vitamin called riboflavin. It's vitamin B2. It's in your cornflakes and in your vitamin pills. But if we soak the cornea in that vitamin and then apply a certain wavelength of light, the vitamin, the light, the oxygen in the environment, and the collagen in your cornea interact to build extra bonds and extra crosslinks. So this is something called corneal crosslinking, and it's been proven out in Europe and every other country in the world. We've got approval in our country about 5 years ago, and it's really an important advance for keratoconus, because if we do this correctly and the patients come in and get identified, we think that we can cross-link all these patients and that we should never have to do a cornea transplant again for a keratoconus patient. I love doing transplants, and I'll still do them for other reasons, but if we don't have to do one for a keratoconus patient, that's a huge win for patients. And so we do these treatments in our office. They take about an hour. They're very boring. They're not hard to do at all. We give you some Valium to kind of relax you during the procedure. The first half hour, you're just laying there with some riboflavin with your eyes closed, and the riboflavin is being delivered. And then the second half of the treatment is about a half-hour treatment where you look up at a light. It's not super bright, and it's pretty easy to do. You just lay there and look up at a light, and then we're done. So it's very straightforward. We don't cut. We're not doing a surgery, but the treatment is so effective that almost everyone it'll last forever. There's maybe a 1 or 2% that where it can be repeated. So anyway, corneal crosslinking for keratoconus is a huge advance, and I highly recommend it.